Well, joining us live with more now is Tom Symondson, the CEO of the Aged and Community Care Providers Association. Appreciate your time. Thank you. Tell us a bit more about this proposal. Obviously, anytime you mention rating superannuation, people get a bit worried about that. It is really controversial, but essentially it seems like the argument here is that people who can pay for more, should pay more for aged care.
Yeah, what we've put forward today is an issues paper that canvasses a whole range of issues, one of which is we need to make better use of superannuation. For those that have wealth, they die with, on average, 90% of the wealth they had at retirement, and some of that is locked up in super. We know that a lot of people have no super or not enough super to retire on, but this is a generation, the first generation, that has significant superannuation savings. And we are seeing people pass a lot of that onto their loved ones when they pass away as an inheritance. $1.4 trillion has been passed on in inheritance over the last 20 years. It's going to rise to about $100 billion a year very, very shortly. It's an option, but we've looked at other options as well. That we've talked about the potential for a levy, which was recommended by the Royal Commission into aged care, but also individuals who can afford to pay more towards their care being asked to do so, so that we can make this sector sustainable and have it flourish rather than die a slow death.
We've been warned for years that the sector is going to be under pressure when the baby boomers start to move into aged care. Just how serious a threat is that to the sector at the moment? Is it on a footing that it's going to be able to handle that?
Well, we're going to see a doubling of the proportion of people who need aged care over the next couple of decades. And we do have a financial situation at the moment that needs addressing. The government has put significant funding into aged care in the last year. They funded a 15% pay rise for care staff, but that's cost them $11 billion. We need significant injections into the future. We are seeing a large increase in demand for home-based services, and we will see in the future a large increase in demand for residential services. So we do need to address this. We have a burning platform, and we want this sector to be able to deliver to people's expectations now and into the future, which at the moment it's struggling to do.
So, Tom, just broadly, how is the sector going at the moment? We have seen a number of reports in recent months about some facilities closing, some citing those new rules requiring a nurse to be on site 24/7. How is that change and the reforms by this government working out in reality on the ground in aged care homes?
Well, we've got a huge amount of reform going on at the moment, most of it coming out of the Royal Commission, which reported now more than 2 years ago. What we haven't dealt with, we've dealt with those things that come out of that report that cost money. We haven't yet dealt with the ways of raising that revenue. The sector is doing it really, really tough. We've had the pandemic, we've had the impact on our reputation of the Royal Commission. We're struggling to recruit enough workers, not just to meet the new hire targets, which we all agree should happen, but also just to get back to where we were before COVID. We've got a workforce shortage across every sector, so we're not the only sector dealing with this. It is a really challenging time, and whilst the government has been good to its word, it has put significant additional investment into the sector. This is a sector that's been underfunded for 20 years. The last time we had a really serious go at changing the financial system for aged care was the 1997 Aged Care Act when John Howard was Prime Minister. So it's been quite a long time since we've fundamentally changed the system. We only get one opportunity every generation. This is the opportunity now to fix this situation for the next 27 years.
Tom Symondson, really appreciate you sharing your insights with us. Thanks so much.